Welcome back to the Progressive Rehab and Strength Podcast. I'm your host, Dr. Rory Alter, here with my lovely co host, Dr. Alyssa Havison. We are clinical coaches here at Progressive Rehab and Strength. And in this episode of the PRS podcast, we are going to be talking about one of the most common, as I always say, questions that we get. I mean, that's why we put this podcast together, to answer all your questions. So, a very frequent question that we get is, how do I start barbell training, or how do I get strong, or where do I start, or what am I supposed to do, and what equipment do I need, and all those questions that a newer strength trainee is looking to get answered, or a clinician who wants to integrate barbell training into, or strength training into, their clinical practice, or a coach who is looking to go, or a personal trainer who's looking to become a strength coach. Where do we start, and how do we identify where a person should start? So what we want to do in this episode is really talk about how someone begins strength training, and we call it barbell strength training, even though it might not utilize the barbell. So what some people call strength training without a barbell, we have one umbrella term called barbell strength training. So before we dive into that, we kind of want to talk about the three people, or types of people, that this episode is geared towards. So Alyssa, do you want to talk about like what those three people are, to help the listener identify if they're one of those three people?
Yeah. So, the first person is going to be the athlete. And even if you don't consider yourself an athlete right now, if you're looking to start training in any capacity, and we're calling it training, but even, if you're thinking of it as working out, that's fine
Mm-hmm.
too. When we say, training, we're talking about something with a plan, and we want you to have a plan. We want you to feel like you're prepared, you know what you're doing, you know why you're doing it, and kind of where you're going. So,
Mm-hmm.
you know, if you have never touched a barbell, if you have never touched a weight, if you've never been in a gym, this is still for you, because we're looking, we want to help you figure out where to start, even if that means starting in your house, in your living room,
Mm-hmm.
with nothing to work with. And then, coaches, if you're a trainer and you're looking to become a strength coach, like you said, Rory, uh, we want to help you figure out how to integrate, or optimize how you're integrating the barbells, how into training, how you're planning your clients, your programs, and really transitioning somebody from being the training client who's coming in
Mm-hmm.
for exercises
Mm-hmm.
and without as much of a plan, to a planned progressed program where they are making progress and
Yeah.
continuing to progress long term.
Yeah, and I think just to kind of touch on the trainer or coach, the personal training realm a little bit more, um, everyone essentially is a beginner strength trainee, or barbell strength training, and we use the term barbell strength training to encapsulate, like I said before, strength training as a whole. So even personal training is actually, the training word is misused almost, because it's personal exercise sessions. If that session does not fit into like a grand scheme of thing program, and it's not a planned session, it's not predetermined what you're going to be doing in that session in the grand scheme of working towards a larger goal, then it's just exercise, right? So for personal trainers who are doing just general personal training, like you kind of show up and here's what we're going to do today, but it wasn't planned, it wasn't precisely determined based on performance last time and where we're going next time, then it's just exercise. And w- personal trainers can transition to a strength coach by utilizing planned progressive programs with their clients to be strength training. Um, and really, everyone who works with a personal trainer or coach usually especially if they've never touched a barbell or they're just going from personal training to strength training or barbell strength training, they're beginners because it's a new stimulus. And most trainers or coaches are going to work with beginner lifters until that beginner lifter becomes an intermediate and advanced lifter. More in the online coaching realm, for people who have been specializing in barbell training or powerlifting, those individual coaches might be working with more intermediate or advanced lifters. But even still, when a program or when a person switches a program or sorry, not switches a program, but switches a coach, and the programming style is different, there's this novice stimulus that happens. So there is a slight novice effect when a person switches from coach to coach, or huge has like a huge program change. There's always, or exercise selection change. There's always going to be this like novice phenomenon happening. So yeah, like you said, Alyssa, the end of the this episode is for the person who wants to get started with barbell strength training, and we'll define barbell strength training in a greater detail shortly, but you don't really know where to start. And so that could also be the trainer who's working with those people, and that trainer is transitioning into this more barbell strength training type training versus just general exercise. Um, and so those trainers or people can have access and willingness to use barbells, or not have access or be unwilling to utilize barbells or not strong enough to use barbells. So we're going to talk about how to figure out what implements to use, in various situations.
So there was a third group of people that we're really talking to today, and those are the clinicians. And even if you are a clinician who is working in a clinic where things seem pretty standard, and you're usually doing some manual work with somebody and TheraBand exercises, but you want to do more with your patients and even potentially transition them to being clients once they're done with their rehab, whatever they're seeing you for in the clinic. You know, that's that's the other thing that we can do with this. And you don't have to utilize barbells, or maybe you want to, but you can use other implements. You can work them up to working with barbells depending on where they're starting, and really give them more in terms of strengthening, having a progressive plan. We've talked in earlier episodes about there really often is no uh, plan or progressive overload in the clinic. It's okay, it's the blue band every time,
Mm-hmm.
or the same weight every time. So, how do we do more for our patients and our clients with the tools we have available, or potentially adding some tools and knowing what those things could be that you're going to get the most benefit out of in
Mm-hmm.
the clinic for a wider range of people? Because maybe a barbell isn't appropriate for your clinic because you're not going to get as much use out of it because of who you're seeing, who else is there. But there could be some other tools that you will get a lot of use out of, that you'll be able to implement exercises with more people.
Yeah, and a lot of times I say we because I come from a physical therapy background where I was in a clinic that I that didn't have the implements that I needed. One thing that I did was I presented to them why we needed the things that we needed, and so I got the things that I wanted. But you might be in a clinic where you don't have barbells and you don't have machines, but there are other things. Like you can do progressive overload with bands and ankle weights, and you can get creative. Like you can somehow load that person, whether it's more reps, more sets, um, change the range of motion, add two bands together, take two 5-pound ankle weights and strap them on like a dumbbell, and that's there you go, you have a 15-pound kettlebell because you've got a 5-pound dumbbell and two 5-pound ankle weights. So you got to just get creative. There's always a way to add more. There is always a way to add more, and you just have to figure it out. So what does barbell strength training mean?
That is a great question. So, and as you already stated, we use the term barbell strength training because we ideally, optimally want to include a barbell into training. But for a lot of people, it might not mean that you're using a barbell or starting with a barbell. So barbell is a tool that we can utilize to get stronger and include in a program that has progressive overload in it. So we can use a barbell to increase the stimulus of training every time that we train in order to, you know, present a greater stimulus to our body and get stronger and make progress. You
Hmm.
know, like you said, Roy, we're usually doing this to work towards some goal to make some sort
Right.
of progress,
Right.
right? So we need that. Uh, but not everybody has a barbell. Not everybody wants to use a barbell. Not everybody's ready for a barbell.
Hmm.
And anything that we're talking about, like as you mentioned, even if you have a dumbbell and ankle weights, we can load movements. We can use kettlebells, we can use bands, we can use dumbbells, ankle weights,
Body
no equipment
weight,
to start.
a
Yeah,
book,
body
like
weight. Yeah.
anything, you know?
The thing that becomes challenging and why we work towards barbells is that at a certain point it becomes hard to progress exercises without a barbell. Kettlebells get heavy, dumbbells get heavy. That's a lot to hold. Even if they weigh the same as a bar, a regular barbell is 45 pounds. A 45-pound kettlebell, holding it to do a goblet squat can be challenging for a lot of people. It becomes
Yeah.
awkward, it becomes uncomfortable.
Yeah.
Also, it requires us to have a lot more of equipment if we're
Hmm.
running a clinic because now we need kettlebells
You
in
need a
small
40, a
increments. All that
45, a 50, a 55, a 60, you
takes up a
need
lot of space.
takes up a lot of space. Yeah. I mean, so there, it just, yeah, I'm just going to run with this here. It's like, so if the barbell is probably the most efficient piece of equipment to have, um, because you can do everything with it and you can add as little as half a pound to as much as whatever plates you can go. It's endless. You can add 1,000 pounds to it, so it's a space efficient. It's also time efficient. You can, because you're not like lugging extra things. I mean, obviously we're changing the weights on the bar, but like, trying to collect all the kettlebells that you need to do the workout that you want to do, like somewhat, it's ridiculous at some point and it's uncomfortable. And at some point, you're limited by what you can hold or what you have available, but you're not limited by the barbell and how much you can hold with that and what you can add to that. So it's really the most efficient piece of equipment. You can hit every aspect of your body. And, we can talk about exercise selection at a later time, but what exercises you're selecting to do, obviously, like we choose the main barbell lifts, but if you're like the bodybuilder mindset where you need to isolate all these different muscles and challenge it from every different angle, like you can do that with a barbell. You can literally do anything with a barbell, but you can't do everything that you need to do or want to do with a dumbbell or a kettlebell or a TRX. You just can't do it. So the barbell is the most efficient piece of equipment, but also we call it barbell strength training, even if you're not using a barbell, because like you said, Alyssa, it's like this continuum or spectrum where not using anything at all, so just body weight is kind of where we start, and the barbell is the ultimate goal. So there are those people who aren't ready or aren't able to utilize a barbell, and when I say ready or able, it could be a physical thing, it could be a mental thing, it could be a location or proximity thing, but ultimately we'll get to a point where we've run out of reps, we've run out of sets that we can add, we've run out of exercises that we can add, and we've run out of load that we can hold that without a barbell. And at that point, the person has no other choice if they want to keep getting stronger to utilize the barbell. Even if you're using equipment in the gym and you're doing like a leg press, a pin loaded leg press, you're going to max out the leg press at some point, but you can
Yeah, and
still, yeah,
I think the other thing worth noting is, like, sure, we could get to the most weight that we're comfortable holding in our hands and then start to add volume and add reps, but God, how far are you gonna go with that? Do you
yeah,
wanna be doing 20, 30 reps
well,
in a set
exactly.
just to say that you're adding more stress?
Well, that's what I
Um,
meant when I said, we're going to run out of reps, we're going to run out of set, and we're going to run out
yeah.
of time, like it becomes really time consuming and really annoying and uncomfortable to do like 5 sets of 20, you know? So and that's not even strength training at that point, that's cardiovascular training. And endurance training. So um, it's this spectrum. Like I said, you're going to run out of reps, run out of sets, run out of time and ability to hold whatever implements you're using. And then at that point, you're going to be able to transition. So we can utilize non barbell implements for barbell strength training to build someone's strength, confidence, and um, a desire to. Like, the more someone might be unwilling to touch a barbell because they think it's bad, or they are, just not interested. It looks scary to them. But at some point, you can be like, well, that kettlebell is 70 pounds and that barbell is 45 pounds and it's easier to hold. So why don't we try the barbell? So the ultimate goal of barbell strength training, even if you're not using barbells, is to transition to the barbell at some point to continue on this indefinite strength training journey. So speaking about strength training or barbell strength training, what does strength training encompass?
Strength training, Rory, encompasses it really is a planned progressive overload with the intention to get stronger, without getting injured. So that's really what we've been talking about. We want to have a plan. And when you were talking about personal trainers, if they're not really planning a workout, we're not just talking about before you go in there, write down some exercises. We're talking about repetition, consistency, doing the same exercises from session to session, getting better at them, increasing the weight, making it a little bit hard. It's going to be a little bit heavier, a little bit harder each session, and having a plan not only to continue progressing that, but also to adjust that and make changes as those changes need to happen, so that we can continue to get stronger without getting injured or reducing the risk of injury. Because at some point, we we can't we can't always add weight to the bar. We can't always add reps if it's a different implement. At
Mm-hmm.
some point, things need to change, and so we can't just always plan
To add
to
5 pounds.
to add 5 pounds to do more. We also have to plan to reduce that stress so that
Mm-hmm.
we can continue to progress and 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 make changes along the way.
Mm-hmm.
And if there is no plan for making adjustments or modifications based on the individual, then things really can go awry, and then
Mm-hmm.
we tend to get off track with meeting our goals.
Mm-hmm.
So usually we're working towards a goal and want to get to that goal or continue working towards that goal without any setbacks.
Yeah, so just a quick aside to talk about goals, because this is something that clients will always ask us, and I think that a lot of times people come in with clear goals, but sometimes they don't come in with clear goals, and I see this a lot with my older clients who come to see me in person. Mr. Doug, who I love to talk about here on this podcast. He's the sweetest guy, and he was like, "What is my goal? Like, when do I stop trying to get stronger?" And I'm like, "Well, you don't. Like, if the goal is to do strength training to get stronger, it doesn't really end. Um, and so getting stronger is essentially the ultimate goal. There could be other goals as well, obviously, like you might have physique goals, and you might have um you know um sport performance goals outside of barbell training, or you might have powerlifting goals or strongman goals or weightlifting, like whatever your goals are. But he was like, well, when I hit 200 pounds, like, can I just stop and stay at 200 pounds? And I mean, you could, but then it's no longer strength training anymore, because that's just like it's not even maintenance at that point, because as you get older, you lose strength, you know? So if you stay at 200 pounds on the deadlift, we're talking about the deadlift. This is his like, oh, this is his like, he always says 200 pounds on the deadlift. Like, can
He'll
I
get
stop?
there.
He's almost there. He's going to deadlift. He just did 180 for 5 and for 3, sorry. He's 78 years old. He's on his second 20 pack of training. So no, third 20 pack of training. So not that many sessions. Like, he hasn't been doing this for that long, you know. And he's a relatively small old man. Love him. And but he's like, well, when I get to 200 pounds, like, is that it? I'm like, well, no, because you're gonna be so much stronger that it's gonna feel like not much to you, you know. And so really it's about, like you said, Alyssa, it's changing the training stress to manage it, you know, to change the program to manage the training stress. And, you know, you don't, if your goal is to always get stronger, then the program should always be progressing, even if it needs to take a couple steps back when we transition to different phases of or levels of advancement, you know, um, or transition from different after the novice stage, we transition to, like, we have to change the program when we kind of reach the end of our linear progression abilities. We then kind of backtrack, but then linearly progress again, you know? But there is no end to strength training, because it just gets slower, really.
I be the question that you were going to bring up, the question of, when is it enough weight? When do we stop? Because, I've gotten that question from various different clients, whether they are older or they, came to me for rehab coaching and really don't have any weight goals. And sometimes,
Mhm.
sometimes they'll say something like, it's not like I want to be a power lifter,
Mhm. Mhm.
but
Yeah, I just had this conversation with another client of mine who really came to us for health and physique concerns more than strength concerns, but she knew that, like, building muscle kind of was the underlying factor that was missing. There were things missing from the nutritional coaching that she was getting from other areas, from other people that she was working with. But um like, every time she gets to, it's so funny, it's like around 180 for her on the deadlift also. um she always asks, like, it's getting heavy, it's getting really heavy, can we lower the loads again? And I'm like, mm-mm, not this time. Like, I gave you one freebie, Lex, but this time we're gonna keep going, because it's so much easier this time. Like, when you look at the videos of her 180, this at this point, relative to where it was, what it looks like when we got to it last time, it was hard last time, and it warranted a little bit of a reset, you know? But this time it's so easy. It's just a mental thing for her, you know? And so I said, Lex, no, I'm sorry. We're going to keep going. Give me 4 more weeks. Give me 4 more weeks. And at the end of the 4 weeks, if you are still concerned, then and things don't look great, then we can make an adjustment. But you're on cruise control right now. You're still making progress, and we can add 2.5 pounds every week on this. So I don't think it's wise to halt your progress. But that's, we said this in the beginning, where it could be access to equipment, it could be a mental block that someone doesn't want to do something, you know. And so for Lex, when I am using her name because we have a testimonial of hers on our, well, not, it's a testimonial, but also like a whole progress post on Instagram, so I'll link that in the show notes. But I'm using her name because this is public knowledge out there. So for her, it's like, we're gonna keep adding weight. And she's an interesting case because we didn't start with barbells for her. We started with non-barbell implements. So we can talk about a little bit about that. Well, we are going to talk a little bit about how to start without barbells, and build your strength to work up to barbells over time. So, but why do we start with the like squat, bench press, deadlift, and overhead press, and not RDLs, or not like front squats or leg press? Like, why not?
those are the best lifts.
Well, why
They
are they the
really,
best lifts?
they really, they cover everything, and they're really the basis or the underlying movements in what we are going to do with anything else.
Mhm.
Like an RDL has principles from
Mhm.
these movements. I also think it can be very confusing if from the beginning we're teaching RDLs and a deadlift and
Mhm.
but
Mhm.
they're going to give you the most bang for your buck in terms of the muscle mass that you are utilizing and the stress that you're placing on your body in a given movement. So if you want to get the most work done in the least amount of time and not spend 3 hours in the gym
Mhm.
trying to train every single individual muscle, which you can't do, you know,
Can't train muscles, and I mean, you
like,
can do like no muscle works independently,
yeah.
and so all these muscles, like your core is going to work with every exercise you do. Your rotator cuff is going to work in combination with your scapular muscles and your biceps and your pec muscles. Like it's going to work in combination with your deltoids as well. So you're going to get like we might as well just do one movement instead of 15 movements. And I do like what you said. I think like when we're thinking about injury risk reduction, the more exercises you do, the more exposure you have to injury. And also time efficiency. Like you said, we don't want the workouts to be like 3 hours. And I think this is important. We should talk a little bit about as you progress, as you go from like novice to intermediate to advanced, you're going to start adapting to volume and intensity, and you're going to need at some point we can't be a beginner anymore if we don't take breaks and we keep going. And I'm talking like a 1 week break will not take you all the way back to the beginning, but if you take like 4 weeks off or a month 2 months off or whatever, that kind of sets you back and you kind of backtrack and then have to go forward again. So there are some people who are just perpetual novices, but if you're going to stick with this long term, you're not going to be a novice at some point. And when we're no longer a novice, we tend to need more exercises included in our program. We need a little bit more volume. Excuse me. We might need more training frequency. So we might need to go to the gym more days per week. And if we start off with too much, then we're just going to end up with too much. It's just going to get more and more and more that we have to add to keep making strength progress, physique progress, all that kind of stuff. So we want to utilize every goal that we're trying to achieve. Applying the principle of minimal effective dose will help us maintain our ability to work towards those goals without interruption or injury or overload or overtraining long term, right? So we're going to choose exercises like you said, Alyssa. They're the most efficient exercises. They train all of the things, like every muscle is included in every lift in some capacity. So the main barbell lifts are going to be time efficient and volume efficient and intensity efficient, right?
So what about somebody who says, yeah, I get it, but that sounds boring.
Right.
And I don't just want to do that. And I want more variety. Are they like, shooting themselves in the foot from the beginning in terms of where they start, or what should we do with those people?
Yeah, I mean, that's definitely a fair question, and we run into this a lot, especially with the person who's a little bit more resistant to barbell training, um, who they come to us, or they're entering the zone of barbell training because they know that barbells are the way to go, but they're really not ready to let go of their past selves. Like they like doing the bicep curls, they like doing the machine, like whatever, they like doing all the stuff, and they feel like they need to get a sweat on or a pump on or whatever, right? When we first start out on a novice barbell program, it's really easy and our recovery is really good, so we can kind of include those things for a little while, up to a point where it won't compete we're not going to be competing for resources. So I say, from like a coach or clinician perspective, it's okay to include those things in the beginning, especially if you're trying to get buy-in from someone um, to to accept the barbells as the main source of resources for strength training, right? So it's okay in the beginning, and naturally, as they start to see the benefits of barbell training, they will, and as the barbell lifts start to get heavier and harder, they'll realize they're not recovering, and they'll realize that the thing that's promoting their progress are the big lifts versus the little exercises. So you can either drop those or redisperse them throughout the week in some capacity. But of course, we're never going to say to someone, like, you can't do any of those. If that's something that keeps you happy and interested and enjoying your workouts, do them. It's about managing the whole program and your recovery to the barbell training lifts, um, in order to continue to make progress without injury. And that's why we utilize RPE with all of our programs. And even if someone's a novice and they've never been exposed to RPE, even from the first session, we're going to introduce it so that they can start learning it, because as you progress, so RPE is rating of perceived exertion, and I'll link an article to explain all of that. Um, but we utilize that from the beginning in all of our programs, because as things start to get hard, you will start to learn what hard RPEs feel like, and be able to create your own unique rating of perceived exertion scale. And that will allow us to measure recovery and manage our training, the barbell training program, in response to everything else that's going around. So you get little sleep, your nutrition's poor, or you really want to keep bicep curls and hamstring curls in the program, like, your how hard things feel will be reflected in rating of perceived exertion, so that your recovery and fatigue is measured in some way.
Yeah, and for just to clarify for anyone who just got here, when we say we utilize RPE for the main lifts, we are typically utilizing a descriptive
Mm-hmm.
RPE. So though
Mm-hmm.
we might be programming actual weights, we want our clients to be able to describe how hard everything felt, and then and we look at just at videos and determine how hard we think things felt, to help guide program decisions, understand how someone's recovering. But we are typically programming weights rather than programming RPEs. But you know for the smaller exercises, if somebody wants to do barbell curls, well, or not, or bicep curls. Goodness, that's
Well, they could use the
yeah, they
barbell
could
too.
be it could be barbell curls. What was supposed to come out of my mouth was bicep curls. Then we could give them an RPE to aim for, because that's a smaller exercise, and the weight that they use based off of that RPE could be determined by how hard things were before they
Yeah.
even got to that. All of
Yeah.
the other training stress.
Yeah. So I think what we should talk about now. So we talked about the what barbell. Why there's like a frog in my throat. We talked about why what barbell lifts, and we do the main barbell lifts, just to kind of sum it up. We do the main barbell lifts because they give us the biggest bang for our buck. They incorporate all of the muscles in every single lift through the greatest effective range of motion, available range of motion for someone, right? And if we're utilizing a variation, it's going to be either a longer or shorter range of motion. So longer range of motion means you can't lift as much weight, and a shorter range of motion means you're not lifting through as much range of motion and strengthening through as much range of motion. So we want to be able to lift as much weight as possible, obviously without it being a max effort lift. But the reason we want to utilize the most weight possible is so that we don't have to do a million other exercises. So the main barbell lifts, so the low bar back squat, the barbell bench press, the overhead press, the standing overhead press, and the conventional deadlift are going to satisfy this criteria of the greatest moving the body through, or the barbell through, the greatest effective available range of motion, um, to lift the most amount of weight possible. And that doesn't mean that you have to do the low bar back squat or the overhead press or the conventional deadlift or barbell bench press. We're going to recommend those lifts if you are able and willing to do them and strong enough to do them with whatever barbell you have available. So if you have some type of issue where you can't lie down, uh, then do an incline bench press. If you have some type of issue with your shoulder that or elbow or whatever wrist that makes it really, really uncomfortable to do the low bar back squat, or the low bar back squat hurts your hips, obviously we want to address it from a technical perspective first and make sure all our boxes are checked before we say, you know what, try high bar. Feel better, do the lift. We don't care. We want you to squat, right? So, and if you can't do the overhead press because you don't have the shoulder range of motion, you can do an incline press, so, or whatever, or you don't have the available, like you're not strong enough to lift the 45-pound barbell, dumbbells, it's fine, but those are the main lifts that we choose, and the variations are just less range of motion or um, not enough weight, basically. So, in terms of the rep scheme that we choose, we're going to think about what someone can recover from and how much can make someone stronger, and how much can we do that we can add to in the future, right? So you might see these strength programs that people say are okay for beginners that start on like 10 by 10 or 5 by 5, but that's a lot of volume that isn't necessary, especially if you're a novice. A smaller stimulus is usually okay to perpetuate this stress recovery adaptation cycle. So we generally find that 5 reps for 3 sets of 5 for the squat, bench, and overhead press are a really good place to start. Not forever. Why not 6? Why not 6? If you want to do 6, go ahead and do 6. I don't care. There's not much of a difference between 6. But when we're looking at the spectrum of volume and what volume does in terms of endurance versus strength, and where do we get a cardiovascular effect, and how much weight relative to your genetic potential or your potential at the time are you lifting, this 5 rep range tends to the 6 to 5 reps, like whatever, like there's always people who like, well, why not 6? 4 is a little bit too not enough. 6 is fine, but who wants to count to 6? I get lost after 5.
I get lost
I just
getting
get
to
lost.
5.
I just get lost. So anyway, 5 by 5 is a lot. That's a lot of sets. It's a lot of time. It's a lot of volume. Where do you go from 5 by 5? You got to go to 6 by 5, 7 by 5. It's like a lot. Whereas for the novice, we can then go to 5 by 5 when we need a little bit more stimulus, but we can't add any more weight at the time. So 5's a really good place to start. There's a little bit of a cardiovascular effect. There is a strength effect. There is somewhat of a hypertrophy effect as well. But so it's a very like all encompassing rep range. Again, minimal effective dose. If you do 10s, we're not going to be in a load range that's enough for really like a strength effect. If we're in the 2s and 3s, the loads are going to be so heavy. We're not going to be able to maintain our technique as we're learning technique. And also, we're not going to get much of a cardiovascular or endurance or hypertrophy effect from that. So this 5 rep range allows the load to be heavy enough, but not too heavy, where we can focus on technique and learn technique. Stimulates our cardiovascular system, stimulates hypertrophy, stimulates strength and endurance as well. So the question then is, well, how, like the deadlift, right? We're going to do the deadlift, and most people end up doing 1 set of 5 on the deadlift, and that's the case in our program as well. Now, why? Well, because the deadlift is going to be the heaviest lift. We can lift the most amount of weight with that, and we're doing it at the end of the training session. It's usually the last lift. And so, but at that point, we're toast. Well, we're not totally toast, but we're getting tired. And 1 set of 5 is enough to promote the strength and hypertrophy effects that we're looking for that lift. Anything else you wanted to add, Alyssa?
Yeah, the other thing I think worth mentioning is, once we get too far past fives, that's when we start to see, fatigue at the end of the set, technique breakdown, and
Mm-hmm.
really we want to train consistent technique. We
Mm-hmm.
want to be able to reproduce the same technique on every rep of every set. And when we start to see that technique breakdown, if we're doing 8, 10 reps,
Mm-hmm.
we're starting to learn it. We're increasing the chances we're going to see it at heavier weights. So,
Mm-hmm.
5 is also that comfortable range where it's not so tiring at the end of the set if the weight is appropriate for that rep range.
Mm-hmm.
And yeah, and obviously, deadlift, like you said, 1 set of 5, the heaviest, we're tired,
Mm-hmm.
it's more
Yeah.
fatiguing.
Well, the other question I guess that a lot of people ask is why squat first? You know, um, once you start barbell strength training, you'll understand why you squat.
You'll understand that you wouldn't want to squat
You wouldn't
last.
want to squat last. But the squat, even though it's not as heavy as the deadlift, it's the like ultimate strength training lift because your hips, your knees, and your back move through, or your core move through the really the greatest range of motion that it will in any of the lifts. Um, Now you don't lift as much weight as you do with the deadlift, but you're also not like you're moving through a larger range of motion. So what you look like you're about to say something.
Well,
Oh,
yes, you're moving through a larger range of motion, but also the bar is on your
on your
back,
back. Yeah.
and that makes things more the bar wasn't on your back, it would be a deadlift and you could lift more, but, it also it makes it I don't want anyone to think it's a dangerous lift, but, it is on your back. It's not in your hands. You can't just drop it onto the
Mhm, mhm.
floor in front of you. Obviously, you could jump a bar on squat, like, for squat, but, you know, it's harder. You're moving through a greater range of motion. It's and you've got a bar on your back.
Yeah.
It's
No, I like to compare it to triathlons because I used to do triathlons back in the day. And it's like you wouldn't want to swim last when you're tired, you know? And like you said, you don't want to say that the squat is dangerous, but as you said, the bar is on your back. So it's a little bit harder to escape from it safely than it is to escape from a deadlift. Of the deadlift, you can just let go of the bar. And, it might, I mean, I've seen some nasty deadlift injuries. I've seen someone drop, this was a patient of mine, dropped a 600, I don't remember how much it was, but like somewhere in the 450 to 600 pound deadlift right on his thigh. And there was no muscle tearing, but he had like heterotrophic ossification of his thigh going on, and there was a huge indent. But but that's rare, um, with squats, it's you can get stuck under it. You can there's the spotters can get hurt. It can feel like it's crushing you, and we're not trying to scare any
Yeah,
of the
so all that being said, there are so many ways to stay safe when you're
right,
squatting. So we're
right.
not trying to say that squat is dangerous in and of itself if you are doing
It's
everything properly. You can have
it's
safeties, you can have
fatiguing.
spotters. You can use your judgment
Right.
while you're performing the lift. If you are planning to do 5 reps and you've done rep 4 and like you're like, I don't know.
Yeah, and you put it back.
Or you're getting the point where you're starting to be concerned, that's when maybe the set should be over. So,
Mhm.
just using your judgment on things like that. Whereas, yeah, it is a little bit easier to fail a deadlift and you know get out of it safely. But there are plenty of ways to squat safely, even if you were to fail a lift. The way that we program to reduce significantly reduce the risk of that happening. Um, but
So, speaking of programs, I think this is a really good segue into our beginner barbell strength training program, which is a really cool free program that we have had out there in internet land for a long time. But we wanted to actually just do like a full podcast episode, kind of talking about what beginner barbell strength training looks like, what it means, why things are the way that they are in our program. So we've kind of talked about like who this program is for. It's really for anyone who has not been on a formal strength training program or has been detrained or deconditioned from formal strength training in some capacity, whether it's due to injury, illness, surgery, or whatnot, having a baby, just taking time off. So this is it's a 16-week program, but you can keep running it. Like, you can duplicate the program and just run it again if you haven't finished it by that, like if you're still progressing really well. But this program is our traditional beginner program here at PRS, and it will make programming changes for you based on the inputs that you're putting in about your performance in that day's training program. So basically, it's, your traditional novice linear progression, but it can be customized to the available equipment that you have or the exercises that you want to do. So let's say you don't have a barbell. You can program it with dumbbells, and it's all programmed in there for you. You just select your exercises, and then it'll give the appropriate rep ranges for the exercises that you're choosing. So then it is used in combination with rating of perceived exertion. So you'll go in, and every training session, in the training log that's associated with the program, you input the reps that you did, if you completed all of the intended reps, and how hard those sets were. And it will make a training decision and tell you what to do. Either go up in weight next training session, repeat the weight, or change the rep scheme. And it'll tell you what to change the rep scheme to as well. Now, the cool thing about this program is that we make training decisions with our own clients when we're the ones reviewing their training log every week and changing the program for them rather than it changing itself. We look at their performance, their subjective reports, and their overall training stress. And based on their factors, their age, their injury history, their pregnancy history, their recovery, their recoverability, all those things, we'll say, okay, this is kind of these are the signs that we would want to make a change, right? And so in our beginner program, you can do that as well. So in the program, you select if you're postpartum, you select if you are either injury prone or you are recovering from an injury, and you can select if you are in the kind of like 55 plus range, or if you have no concerns. So it will, based on those factors, it will keep the intensity of the program at an appropriate level and make changes before the intensity of the program gets beyond what we would recommend. So it's a really cool program, and it's a really great way for you to begin barbell training with or without a barbell, and also progress with a low risk for injury. We're never going to say no risk, and we're never going to say prevent injuries, because we all know that's not a thing. But so the cool thing is that you can select, like, let's say you want to do split squats or leg press or front squat, whatever. You can input the exercise that you want to do, and it'll either give you a 5-rep range for the barbell lifts, or it will give you like a 10. I forget what the rep ranges are, but they're a little higher because obviously we're not going to lift as much weight with non-barbell implements. So we do a little bit higher volume, higher set volume, not higher reps per set, not total number of sets volume. So that is a really cool program. It's totally free. You download it. There's a bunch of videos that go along with telling you how to use it. And you can also join our Facebook group, the Secret Society of Barbell Mastery, to get form checks to go along with it, because we all know that it's not just about programming, it's about your technique as well. So we do want you to join our Facebook group if you do download the program, so that we can help you. It comes with an ebook that describes how, and all the reasons why and how to use the program as well. And there's a bunch of videos that kind of go through that as well. It also links you to our PRS warm-up calculator, and I forget what else. There's like one other link there for you guys. I can't remember. But okay, so what then if you don't have any equipment or you don't have access to a gym, or you're going away? or whatnot. Tell me, Alyssa, about our no equipment barbell or no equipment strength training program.
Yeah, so I want to start with saying that something is better than nothing. So are whether you are getting started and you don't have any equipment, or you don't want to go to a gym, or you're nervous to go to a gym, or you don't know what to do, or you are you know, you're somebody who usually trains with barbells, you're going to be going away, won't have any access to equipment at all. Doing something is better than nothing. And, if you're new and you're just starting, and you can begin by doing body weight squats and then holding a household object and doing squats, like you are going to make progress that way. You are going to get stronger because you're doing more than you were doing. If you're somebody who's been barbell training for years and you go away and are doing no equipment workouts compared to doing nothing, you're going to feel better when you return and get under the
Mm-hmm.
bar. So we do have a PDF. I don't. Is we gonna call it a program? Program?
Yeah,
Yeah,
it's
PDF
a home.
program.
Yeah, it's
Yeah,
not a so the beginner barbell strength program is actually it's a Google spreadsheet that you'll get, but and it's programmed with everything, and you just implement your data for the training session, and you do your you can there's drop downs and exercise selection and rep scheme selections and all that stuff, and then it utilizes our system to progress based on your inputs. But the home program, just a little bit about the origin of this home program, and you'll get to see the lovely Alyssa and all of the pictures in that program. um, so we put this program together during the global pandemic, which we will not name, because we're so over it. We put it together during then. We had no idea how long the gyms would be closed,
I
but
thought it was like 2 weeks.
oh yeah, we thought it was gonna be
you
2 weeks. But anyway, it turned out to be longer. So we put together a home program that people could do with no equipment, and it was really intended more for the like power lifter. But we realized after that it was a great home program for anyone to utilize if they didn't have access to equipment but they wanted to get into strength training. So really what this program does, it's a 4-day split, but you don't and the thing with these programs that we've got for you guys is it doesn't matter that it's like a traditional 7-day week with like 3 training days or a traditional 7-day week with 4 training days. You just go in the order that the program is written. So if it takes you 2 weeks to get through 3 training sessions, that's totally fine. You just keep going. You know, oh, I forgot to mention this. You do in the beginner program, you do enter the date of the training session. So I would always enter that before you train because it'll tell you like if it's been too long since your last training session, it'll tell you either to repeat the weight, or if it's been even longer than that, it'll tell you to like back off 5%. So always implement the date before you start the training session so that it gives you a little bit more instruction as to what to do. The the no equipment program doesn't. It's not. It's not like dynamic because it's just a PDF with the program. Because you're not gonna like it's. You know, we don't know what equipment you have. We don't know what loads you have. How can you measure like 6 cans of mushrooms in your backpack? You know, like you can measure it, I guess, but it's just a little bit, and that's the problem with non weight
You
exercises
can
like
only add so many cans of mushrooms to a backpack.
yeah.
But also we don't know what things weigh.
Yeah,
So it's
so
hard to
and
to
who wants to do all that math anyway,
progress it
like
the
yeah.
same,
um
every time.
yeah, so it's a lot of AMREPs. But it's a really cool program. We had a lot of people utilize. I think we had near 1,000 people download the home program when we released it, and people are still downloading it because it's on our website. And we've heard really really good things from people. And the cool thing was that when people implemented this program, they returned to the gym and really hadn't lost much strength. So when you do something like this and you're training at intensities that are meaningful, even if you don't have weight, but the intensity is there and the consistency is there, you'll be able to maintain. But from a novice perspective, for people who are not confident to go to the gym and be around people and like utilize equipment and change plates and weights and use the squat rack when other people are trying to use the squat rack, or don't want to wait, whatever. If you're not confident to go to the gym, or you don't feel strong enough, or you don't have time, like I know new mothers, they got no time. So this could be a really good program to start when you're in those early postpartum months and you don't have time to get to the gym. This could be a really good program to implement at home to then build your confidence, build your strength, keep the workout short, but then at some point transition into the barbell exercises in a traditional gym, or gives you time to get equipment for your home as well. So we have those two programs. We'll link them in the show notes, and they're totally free, zero obligation, guys. All you do is go get them and join our Facebook group. After you get them, or if you're not in our Facebook group, join our Facebook group, because we can answer your questions about the program. We can met any exercise that you want to, like, obviously don't troll us in our Facebook group. I'm like, but I don't, please don't post a bicep curl, because like everyone, like, you're doing a bicep curl correctly. Please don't post a bicep curl. But if you want us to look at your lunges or your pull-ups or your push-ups, planks, like whatever, most people post their barbell lifts in our Facebook group, or other variations thereof. But if you're doing a home program and you want us to form check, or even if it's in a gym and you want us to form check something that's not a barbell lift, it's totally fine. Just follow the four video rule in our Facebook group, and no duplicate angles. So go ahead, click the link in our show notes to download either or both programs. And anyone of any age, with almost any, like, be cleared by your doctor for exercise if you have medical conditions. But these programs are really awesome. We've had really good success running them with people for a very long time, and they're free. So go download them, join our Facebook group. And anything else, Alyssa?
I think you covered everything.
Good. All right. Well, we will see you in the secret society, guys. Bye for now.